John. Now, here is Tuesday, 10 a.m., and we are bringing you the updated information of what's happening on the national nation pertaining to COVID-19 and monkeypox. Is all the viruses in our people across the cases of hope, China, so it's always a good information to have what's happening about the world. So let's begin with the show what's been happening these last couple of days and several weeks. The first graph shows the 8 to 9 week, 60-day COVID-19 numbers. So you can see in September, we had 131 cases in 1 week. So these graphs was still 1 week numbers. So you can see right around October, late October, early November, we saw an increase in cases, 782, and see the numbers starting to go back down today. But that doesn't mean always say we have booster shots available. Please, we haven't seen come to visit. We'll see the Thanksgiving holiday numbers. So this ended December 2nd. So this was 1 week before numbers. Doesn't include, I guess, this week we'll see those number of those gatherings, but we were following the protocol, so we should see an increase in cases. The second graph shows you comparison. The orange is the United States, and the blue is now nation. This is beginning from January 16th of 2020 today. If you go to far right, you can see that we had high cases it does show, though, that per capita, we are highest. And this was from the week of November 24th to November 30th last week. And so you can see not just Navajo, but all 4 states around us have some very high numbers. The bottom red line is Utah. You go up, that's Colorado. Above Colorado is Arizona. And then right between Arizona and the yellow line is New Mexico. So in the Southwest, we're seeing very high numbers. So these are concerning to us, and we just ask everybody to continue to follow the protocols. RSV is prevalent in our young people, and we've seen an increase in those cases in our healthcare facilities and around our healthcare facilities. And I understand REMA is seeing many hospital visits because of RSV. So keep your guard up. And in terms of monkeypox, very low cases, none at this point in time. And RSV, again, is starting to increase all around us, all across the country as well. So be vigilant, be careful. November, yeah, katkajin da je keshmish yaje ato beho zinta shin de khagi jo beho shin na kijin da annashon at Tuesday not the morgan shibal na han to da konda ada da huilian de chukuni he master da ido ado a year ago chen da kheda na ja nan tine ta shik no thing Ishibin nache hada inosne. Do the RSV do will yagi na nas negi de do. Do the kosanacha honi hikeni ne binda the nagi do nas ni hota. Ya influenza do ni zebi kijana anneshigi do chudas ashwon shiki no thini. Do booster do bahadlon COVID-19. Era na chada sen shikeno theni. Ada hos ya. Kontra na chekati bikejin de baho. Ato nachen connecta. Ebinin ashi kuta nasni dole. A konda ni keni hinnem ni masani hi cheni na khat chine ya bada huilian dole. Jogot ya a kon hanet ni je konde shikeno theni. Aro here na kun delyazi shido jo hanet do din de kragi de kusunskagi ne kragi RSV monkeypox da yago Asian inche ni ashana ede ido lichich so Asian gut a hanet ni je kunne de liado de the more not leon na kitchen da na chana kodo banda huilne shikeno thing aro ni keni hinne do na galchen hi kita des igi tisba hayaji don de kagi edo keshi da bedi nido de to kunsala na nishide enigi ultra jido na find and vinigi bada ultra gi jokon hot ka nature hot andi na so ne nije hot ka nature shikeno thing so culture shi hanen hi ko na de klaro de Jonathan Nez ani hitne Navajo Nation president. So Kodoshi Del Yazi, which I couldn't push left or left. Del Yazi.
Okay, thank you, President. Hello, everyone. This is Del. I'm with the Navajo Epidemiology Center and our HCOC COVID epidemiology team. I'll provide an update on our latest COVID numbers and our situation on the nation. For the reporting period here is November 24th through the 30th. Weekly reporting, 7-day time period. This is our recent weekly cases and trends. Navajo Nation cases in over a 60-day time period, which is about 8 to 9 weeks, going back to the end of September to end of November. So as you can see, these bars, just going back about a month, we're on this little downward trend, but which is a good sign. But I want to say, like, we're on these last 3 bars here are on this little downward trend, but it's more of on a plateau. But these numbers are still high numbers for us, even with 393 cases last week. It's still a high number of COVID cases for us over a 7-day period. Just for your information, here's some of our core metrics. Our 7-day case rate is at 248 cases per 100,000 people. As I mentioned, that's still a really high 7-day case rate for us. And then percent staff beds occupied by COVID patients is at 8.2%, which is medium risk. And then our hospital admission rate is at 1.31. It did go up a little bit from 0.65. So we'll continue to monitor this, but still at medium risk. Some additional metrics here. As I mentioned, there are 393 new cases over 7 days, which is minus 22% from the previous week. And then our 7-day lab-based test positivity is at about 21%. Did this increase from 19% previous week? So we'll continue to monitor this. And then our hospital bed occupancy, regular beds is at 69%. ICU beds for the first time has gone above 80%, which is our 80% is our threshold. So we're right around our 80% threshold. So we'll closely continue to monitor this, especially with our updated report this week. And then our vaccine coverage as of November 25th, about 70% have completed the primary series. And then about 17% are up to date. Vaccine, of course, the vaccinations are still ongoing. We continue to encourage our people to get vaccinated and get the latest booster. The COVID strain surveillance is ongoing still. I saw some of the new numbers come in this morning. We should have a new report probably later today. So here are the Navajo Nation residents who are vaccinated with the primary series is about 131,766. And then those who are up to date are at 32,558. This is our epidemic curves for Navajo Nation in blue, and then the US in red. So even the US is on this little plateau here, seeing also high number of COVID cases across the country. And we continue to fluctuate a little bit on Navajo Nation, and we're, as I mentioned, decrease in numbers, but still high number of cases for us. As shown here, we have the highest 7-day incidence rate compared to the 50 states. And even within our 4 corner states, within our region, there are also a lot of COVID cases within New Mexico, Arizona, Colorado, and Utah. As shown here, Arizona, New Mexico, these darker shaded blue colors, meaning there's a high COVID cases over a 7-day period, including Utah and Colorado. Still within our region, high COVID transmission. All the counties within Navajo Nation continue to remain in the red color for high COVID transmission. I'm going to skip these two because I already mentioned this last week. This will be updated probably later today. I saw, as I mentioned, a new data set that came in this morning. So just that we're still seeing a lot of BA.5 and the sublineages of BA.5 Omicron on the nation. Then last is this CDC variant profile, also across the country, the BA.5 and its sublineages, which are the BQ.1 and the BQ.1.1. They're accounting for more than half of the infections currently across the U.S. Actually, it's more than like 3/4 of the infections being accounted for are due to the BA.5 and its sublineages. So I'm going to stop here. It looks like Dr. Va has also joined us. She's also our HCOC COVID epidemiology co-lead with us. So I'm going to stop here and hand it over to her to give us some updates and talk about maybe our flu and RSV situation on the nation, plus the vaccination. So Dr. Va, take it away.
Much, Del. Let me go ahead and also just share some talking points so that the audience can follow with me as well. And let me go ahead and do that to the team here. And so thank you guys so much for allowing me to join today. And of course, I'm joining on behalf of our IHS partners, Captain Johnson, Dr. Gaines, who are not able to make it today. But thank you, Del, for the introduction, and thank you, Del, for covering the COVID piece. One of the things that, both our IHS leadership and facilities are working in partnership with the Navajo Nation is sort of tracking and monitoring what we're calling like that triple threat, that triple-demic. And so it's not just COVID that's stressing our communities and our systems, it's also RSV and flu. I know I had a chance to join this very same town hall last week, and I touched briefly on the flu. And so let me just give you a sense of what's happening regionally, and then give you some thoughts on what's happening locally as well. And so, we do track and monitor these respiratory activities, including respiratory syncytial virus, which is RSV, and influenza. And so what we're seeing is, yes, there is high activity in Arizona, Colorado, and New Mexico. And you sort of see this, I'll just give you an example. For Arizona, you sort of see this rise and fall, and then this rise again. This rise and fall, that's last season. So that was last fall and winter season. And then this new rise, that's this season, starting around like September of 2022. And similarly for Colorado and New Mexico. And so what this graph tells us is that RSV activity here in this region is high, but likely peaking. And then in terms of flu activity, what we do know is that flu activity is actually quite high right now in this region. And let me just show you what that looks like and why that is. Sorry for that. And so for flu activity, what we're seeing, and I think this is probably the biggest red flag, is not only is it just COVID and RSV, but it is also flu. And so what we're seeing right now is that flu activity, as noted by the CDC leadership, Dr. Walensky, it's actually highest it has been in over a decade, with increase in hospitalizations. We are seeing incredibly high activity in New Mexico and Colorado, followed by Utah and Arizona. And so we know the activity is high here. And the other thing that we're seeing is that we're seeing the same thing here in our IHS facilities as well as on Navajo Nation. So we know, yes, COVID cases are high, but so is RSV, which is peaking, but flu is really skyrocketing. And so just some take-home points is that, nationally cases are increasing for COVID since Thanksgiving with an increase in hospitalizations. We're sort of seeing a similar pattern here is that there are an increase in COVID cases. Luckily, hospitalizations have been somewhat manageable, but unfortunately, it's not just COVID, right? It's the other respiratory illnesses. It's RSV, which we don't have a vaccine for. And so there's ways to protect against RSV. All the things that we're doing for COVID will work against RSV. And in addition to that is making sure that, sanitation of high touch areas are important, in addition to masking and staying away from people when you're sick. And then for flu, we are seeing incredibly high activity, more activity than we've seen in, like I said, over a decade. And we are seeing increases in hospitalizations. One thing I want to talk about flu is that the circulating strain right now is that the vaccines do work. It works against influenza A, and that is the majority of the strain that's circulating nationally and regionally. What's likely happening is, folks during the winter months, people gather, right? And people are gathering indoors. And so there's more opportunity for transmission, but on top of that, flu rates are low. And we know that the flu vaccine works. And so flu vaccine rates nationally among our high risk group, older folks, 65 and older, and young children and pregnant women are lower this year than they were last year. And that's a national trend. And it likely is a trend here as well, as flu rates in general are lower this year than they have been last year. And so that level of population protection is not where we want it to be. And so higher rates, higher hospitalization, higher severity, some stress on our hospital systems, especially in New Mexico, and some stress on our Arizona systems as well. We're monitoring it closely here in our IHS facilities and communicating that out with our Navajo Nation partners. But there is something I do want to share today on this platform, is that with the increase in influenza activity right now and the low rates of vaccines, I do understand is, there's our high risk groups that we want to make sure gets vaccinated. And of course, that's our elderly people, 65 and older, so grandmas and grandpas, and then our youngest group. And so I'm going to take the time to sort of go over that right now. And when I say our youngest group, that is high risk is anyone between the ages of 0 to 2 years, but really also 0 to 4 years of age. That group, that pediatric group, is commonly captured through what we call pediatric wellness visits. And so what I mean by that is that for that age group, if you know anybody in your family that that has not been vaccinated against the flu, please encourage them to go to get vaccinated. And so we want to encourage that age group, 0 to 4 years, in particular 0 to 2 years, to come in to get vaccinated and to stay up to date with their wellness visits. And so kids should be seen by a pediatrician or a provider at these regular intervals, 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, and 18 months. And then after the age of 2, they should be coming in every year. That is when our pediatric team, our family practice team, our provider team can really make sure that those kiddos are up to date with their vaccine. Something else to note is that you cannot get the flu from getting the flu shot, and you cannot get you cannot get the flu from the flu shot. The flu shot may not keep you from getting the flu, but very similar to those COVID vaccines, is that it will keep our kids and our high-risk individuals from getting really sick. So ending up in the hospital or with the worst-case scenario. And so what I would like to reiterate is that the flu vaccine works. And if you know anybody in this age group, please encourage them to get their wellness visits where a doctor or a provider can really make sure they're up to date with all their vaccines, including the flu vaccine, as well as the bivalent COVID vaccine once that's available. And if anybody is 65 and older or any pregnant women who have not been vaccinated, please encourage them to get vaccinated. One of the things we want to prevent is, of course, hospitalizations, but the worst case scenarios is death. Is that typically folks do get over, they do get the flu, they do get symptoms, and they can get over it. But we are seeing an uptick in flu-related deaths, pediatric deaths in particular. So this is national numbers. And so I do want to encourage people like the importance of the flu vaccine. And like I said, we aren't seeing our rates where they should be, specifically among the youngest and most vulnerable population. Thank you so much for joining us on this call today. And I do see that Dr. Jill Jim is on. Dr. Jim, will you be going next?
Yes, Dr. Va, this is Dr. Jim. I'm not in the office, so I won't have my camera on, but I just want to thank everyone for joining the call, and thank you, Dr. Va, for providing the update, and President Nez for continuing to have everyone follow the COVID-19 safety practices and guidelines. So I know that we have just finished Thanksgiving celebrations, and I think we keep reminding everyone that it's important to look for signs and symptoms. I think, as you probably mentioned, Dr. Val, we have RSV, flu, and the common cold that are out there as well. So we just need everyone to take the same preventive measures out there while we're at home. Some individuals might be coming back from college too, students coming back home for their Christmas break. And there are testing kits that are still available at health facilities and at the CHR offices. So there is testing kits that are available. So if you need one, and a couple of them maybe before you have a Christmas dinner, just preparing for that, do that as well, and have that on stock for people to take their tests while they join the holiday gathering in your household. So. And just a quick reminder, I know we still have an indoor mask requirement, but all other gathering limits have been lifted. So just be careful out there when you're gathering in the public at chapter meetings or office parties or school classroom parties as well. There's just going to be, I know, a celebration that will be happening in all different places. And so just want to thank everyone for listening in and tuning in each week as well. So I think Del is a member of our Health Command Operations Center, and he'll also provide us a report, Dr. Va. I'm not sure if Del is going today, but I am done with my part. So thank you for listening, everyone. Ada,